Dr. Ray Samoa is a clinical research endocrinologist at the City of Hope National Medical Center located in Southern California. His current clinical trials include breast cancer survivorship, metabolic syndrome intervention and prevention, community-based diabetes prevention programs, and cancer therapy-induced endocrinopathies such as type 1 diabetes. Dr. Samoa frequently conducts teaching and services regarding diabetes in Pacific communities in the continental US and in the US associated Pacific Islands. Welcome, Dr. Samoa.
Welcome, distinguished guests, esteemed elected officials, our Asian Pacific Islander National Organization partners, concerned individuals, and especially our Pacific Islander communities here in the US and across the globe. I wish it was under more fortunate circumstances that we gather here today, but we are in the midst of a crisis. The COVID-19 pandemic has touched the lives of everyone on this planet in some fashion. Unfortunately, its devastating impact is ripping through vulnerable communities. One of those is the Pacific Islanders in the United States. Pacific Islanders are showing to have the highest rates of disease and death in California and in other parts of the country. The rates we are about to tell you will seem astronomical to believe, but we have every reason to believe they're true. The disease rates in the next highest group in Los Angeles County is within our Latino family, and the rate is listed as 114 per 100,000. The rate in Native Hawaiian Pacific Islanders is 840 per 100,000, a seven-fold difference. The death rate in Pacific Islanders is 12 times higher than our white neighbors and friends, 7 times higher than the Latino community, 5 times higher than our African American sisters and brothers. And our numbers continue to worsen. Many ask why. The answer appears to have many layers. Pacific Islander communities are small, which means they're invisible to standard disease surveillance techniques, like what is being experienced in other vulnerable indigenous communities, such as Native Americans. Federal, state, and county and local agencies charged with fighting this pandemic are unable to access our communities. Overcoming this obstacle will require a partnership with these entities and community engagement experts to locate Pacific Islander families in need. Pacific Islanders are also susceptible to the effects of COVID-19 due to a long history of poor access to economic resources and healthcare, as well as we share these conditions with African American and Latino communities and stand firmly with them to fight these obstacles. Pacific Islanders have a long history of being victims of stigmatism and being scapegoats for conditions we have little control of. For this reason, we stand firmly against racially fueled violence brought on by COVID-19 against our Asian brothers and sisters. We also stand firmly with all people suffering in this pandemic. One of the major contributing factors to high susceptibility to COVID-19 in Pacific Islanders is the high percentage of of essential workers that make up our community. Every day, they risk their health and the health of their families to provide service to the larger community. We implore that we honor their sacrifice by providing more protection for them. Personal protective equipment, hazard pay, free testing should be in place before governors consider opening these states back up. Today, we'll present you some alarming figures, speaking of how COVID-19 is ravaging our community. As a community, though, we refuse to lie down and surrender to this pandemic. We bring you here today to hear a message of unity and to hear promising and innovative ways the community is trying to meet the needs of our people that are left undressed by the current public health approach. The people you hear today are a small part of a much larger movement to help, because the problem is not just in California. It's in Washington State, it's in Oregon, Utah, Las Vegas, Colorado, and Hawaii, and more. It's spreading to our communities in the South and the Midwest United States. The National Pacific Islander COVID-19 response team will present their findings and what they are doing in select regions across the country later on in this press conference. Elected officials are here to lend their support, as are many organizations and many of our community, along with our friends and neighbors, together. Because I don't know how we're going to get through this pandemic without each other. Thank you. So I will turn this back over to Joseph to lead the rest of our press conference.
Thank you, Dr. Samoa. Dr. Samoa's birthday was last week, by the way, so you guys can wish him happy birthday. It's still his birth month. But next up on our press conference speaker is Congresswoman Judy Chu. We thank you for joining us today. So Congresswoman Judy Chu was first elected to the U.S. House of Representatives in July 2009. She represents the 27th Congressional District, which includes Pasadena and the West San Gabriel Valley of Southern California. Chu was first elected to the Board of Education for Garvey School District in 1985. From there, she was elected to the Monterey Park City Council, where she served as mayor 3 times. She then was elected to the State Assembly and then California's elected tax board, known as the State Board of Equalization. In 2009, she became the first Chinese American woman elected to Congress in history. Thank you for joining us, Congresswoman. And if you want to, Congresswoman, if you could unmute yourself.
Always forget. Okay, thank you so much to the Pacific Islander COVID-19 response team for inviting me to join this important press conference today. The coronavirus has upended our entire country, but it's been especially devastating for communities of color who've been disproportionately impacted by the public health and economic crisis. And while there has been a lot of focus on the disparities faced by the Black and Latino populations, the Native Hawaiian and Pacific Islander or NHPI community has been largely overlooked, even though the data shows that they are the most impacted racial group in many states and counties across the nation. So it is critical that we shine a light on these inequities and ensure that our NHPI families are getting the resources they need to weather this crisis. You know, Asian Americans, Native Hawaiian, and Pacific Islander workers are some of the people deemed most essential to our country right now, including in fields like healthcare, transportation, and those working in grocery stores, warehouses, food services, and other industries. As APIs take on greater risk on getting us through this crisis, they are also highlighting the disparities in our healthcare system, because while APIs may be more likely to be essential employees, they're also less likely to have the same access to healthcare. And that is leading to dangerous outcomes, and it's being felt in greater numbers in the NHPI community. Now, it truly distresses me that here in California, NHPIs are 0.3% of the total population, but the level of infections and deaths due to COVID-19 are triple their population representation. And these numbers are similar across the country. Across the country, COVID-19 case and death rates are the highest for NHPIs compared to any other group, including African Americans and Hispanics in the states of Washington, Oregon, Arkansas, and in Nevada, in Clark County of Nevada. And there are states like Utah and Colorado that are also reporting similar disparities among their NHPI population, who have infection and mortality rates that are several times higher than the general population. And so we need to make sure that we are supporting our vulnerable workers and families. We also need widespread testing and contact tracing. Unfortunately, this is one of the biggest disparities for minority communities. Testing is the key to getting us to the other side of the crisis. But if we don't know who's infected, we cannot stop the spread of the virus. But the US is facing a severe shortage of testing nationwide. And as a result, our cases of COVID-19 in our communities are being undercounted, hiding not only the harm, but also the need. And that's why it was so important for us to include an additional $25 billion in the last bill that we passed, the Paycheck Protection and Healthcare Advancement Act on April 23rd. We did that because we saw this disparity on communities of color. And so we fought, the Democrats especially, to fight for a ramping up of our testing infrastructure. Because already we're seeing discrepancies on who can be tested for COVID-19. There are reports of the wealthiest individuals like movie stars and pro athletes being able to access tests, while everyday Americans who know that they've been exposed to the virus are unable to get a test unless they're hospitalized. But it doesn't have to be this way. And in fact, in my district of Los Angeles County, anyone with COVID-19 symptoms can be tested. You just have to be a resident of LA County and sign up for an appointment online. Priority is given to seniors and frontline workers, but most appointments are made within a day or two. And in the city of Los Angeles, at their 8 testing sites, anyone can receive a test, even if you aren't showing any symptoms. So you know what? We know it can be done. LA County is doing it right now. And we need to ramp this up across the country to ensure that those taking on the greatest risks for us also have access to testing and treatment. I'm also pushing my colleagues in Congress to make serious investments in our testing infrastructure to make sure everyone can have access to testing. And I push the Trump administration to utilize the Defense Production Act to ensure that we have enough materials for our tests, such as swabs or reagents, to run the tests themselves. But that's not the only thing the Defense Production Act can be used for. With so many NHPIs working on our front lines, we need to ensure everyone has adequate and appropriate personal protective equipment, or PPE. No one should go to work and find that their employer hasn't provided them with enough PPE because supplies are short, or even worse, forbidding them from wearing any PPE at all. So I'm fighting in Congress to make sure that we have enough PPE in our nation so that people can get back to work safely. Now, it's vital that while we make these tests and treatments affordable and accessible, regardless of whether you're insured or not, but we also need to make sure that treatment is available to everybody. Now, already, we in Congress made testing free to everybody, regardless of insurance status. But I'm still fighting to make sure that the treatment for COVID-19 will be available to everybody, to the uninsured, to those who might have excessively high copays or additional cost sharing. Because while NHPIs are more likely to be essential and at risk, they're also more likely to be uninsured and face health disparities like higher rates of heart disease, diabetes, and cancer that make them vulnerable to COVID-19. So that's why I'm proud that just last week, the Tri-Caucus, or the Congressional Asian Pacific Caucus, the Congressional Black Caucus, and the Congressional Hispanic Caucus teamed up to introduce the Health Equity and Accountability Act. This bill targets long-standing inequalities in our healthcare system, and it focuses on important priorities for the AAPI community. And that includes ensuring that we have access to disaggregated racial and ethnic data, which is so critical for NHPIs. Because we know that
30 more seconds, sorry.
without that, then their needs will be masked. And lastly, we need to make sure that NHPIs are addressed economically. Now, they are in jobs where they definitely need a hand up. And I want you to know that as chair of the Congressional Asian Pacific American Caucus, I've been laser focused on making sure that NHPI's needs are heard and that they know what dire situation this is. So we have teamed up in the Tri-Caucus to make sure that our Democratic caucus knows what's happening with NHPIs. And in fact, there is an alliance of researchers of color that can shed a greater light to the disparities that is occurring right now. So there's more work to do. We are in the process of writing a 4th recovery bill. And while details are being worked out, I believe it must include more support to help NHPIs get back on their feet as soon as this crisis ends and that they get the health care that they need. Thank you.
Thank you, Congresswoman Judy Chu. We'll have a question and answer session after all of our folks have spoken that are lined up today. But next up, we have Assemblymember David Chu. Assemblymember David Chu represents the 17th Assembly District of Cali State Legislature, which encompasses Eastern San Francisco. He was first elected in 2014 and re-elected in 2016 and 2018. He is currently the chair of the California Asian Pacific Islander Legislative Caucus. The son of immigrant parents, David Chu grew up in Boston and received his undergraduate law and master's in public policy degrees from Harvard University. After moving to San Francisco in 1996, David Chu served as a criminal prosecutor at the San Francisco District Attorney's Office and as a civil rights attorney with the Lawyers Committee for Civil Rights. Chu was also a founder of the public affairs technology company Grassroots Enterprise, where he served as Chief Operating Officer. Welcome, Assemblymember David Chu.
Thank you, Joseph. Good afternoon. And to everyone on this call, I hope you are doing as well as possible given the circumstances. And thank you for all that you're doing for our communities and particularly for our NHPI community. I want to take a moment and just thank the response team, the Pacific Islander COVID-19 response team, for your leadership so we can share information and advocate together. This is incredibly critical work. I also want to just thank the leadership of Congresswoman Judy Chu, who's been an incredible champion for API communities in Congress. I'm here, I represent San Francisco. I'm actually speaking from Sacramento, California, but representing the API Legislative Caucus. We have the highest number of Asians ever in the California State Legislature. There are 16 of us, but I'll just note, we are hoping to elect someone from your community sometime, hopefully in the not too distant future. So we all know that coronavirus has shown an incredibly bright spotlight around all that is wrong with society, all that is broken. The virus has really highlighted the disparities and the inequalities, particularly when it comes to how communities of color have experienced health. And on top of that, we also know that with coronavirus, there has been the virus of racism. Just this past week, there was the announcement of 1,500 reported incidents of anti-Asian hate just in the last couple weeks alone. So we have a lot of work to do. I don't want to repeat what Congresswoman Chu just said. Let me just touch upon a couple of priorities for our caucus and ways that we hope to partner with you with this response team. And the first is around data. We know that if we don't have information, if we don't have data, if we can't track what's actually going on, we can't address the problems. And our caucus, for years, we have been championing the disaggregation of AAPI data because we know that our communities are not monolithic, and what is true for East Asians or South Asians or Southeast Asians may not be true for our Native Hawaiian and Pacific Islander communities. So this is something that we have been pushing strongly. We need clear and consistent and comprehensive data throughout the country, really to ensure that all public policy officials, but particularly public health officials, can provide the targeted outreach and services that we all need. And we look forward to working with your task force to advocate for equitable data policies. Secondly, and this was already mentioned, but we know that all of our communities need more testing. And I think the statistic that 2/3 of all NHPI COVID-19 deaths are in one portion of our state in LA County just points at how important it is for us to test, to contact trace, and as the Congresswoman just said, for us to treat. We know that high rates of coronavirus are due to social determinants of health, and the fact that a significant share of your communities are essential workers, and without adequate PPE are at higher risk of contracting COVID-19. And so we are very, very committed to working to make sure that everyone gets tested, but particularly our communities of color that have been challenged. We can do better. The third thing I want to say about what I think we need to do is the NHPI community needs to have a seat at the table in ways that you haven't. I know, for example, in California, we have a COVID-19 task force that I've been told folks on this call have not been in touch with them in the way that we want you to. And I want to just commit to you that I'm more than happy to work with your task force to facilitate the connections and relationships and introductions that are critical so that we can all find solutions together. I think it's a cliche, but it needs to be said that we are all dependent on each other. We have an obligation to take care of each other, our brothers and sisters from different communities, no matter where we are. And we can only do that if we are working together. And for that, we also have to work together to fight stigma, to fight blame that is placed on different pockets of our API community members with COVID-19. I represent the city of San Francisco that has the oldest Chinatown community in the country. We also have one of the oldest Japantowns, Little Saigon, Filipino communities, as well as other Asian and significant API communities. And we were one of the earliest cities that got hit before coronavirus even came to our country because of stereotypes of the fact that folks who look like us might be somehow passing along the disease. And our caucus has taken a leadership role in working with our governor and nationally to denounce discrimination targeting API communities, to push resources and information. If you go to the website for our state efforts around COVID, you'll find information that our governor put at our request around how to address discrimination and what sort of resources are available to all communities. But we have more work to do, and I want to really just encourage all of you to work together as we champion the types of policies that we need. The last thing I want to say is conversations I've had with API leaders around the country, whatever community you're from, wherever you are, we're all experiencing many of the same and intense things. And as a result, I am working with Asian American elected and community leaders around the country to convene a series of national town halls starting this Friday. If you visit riseapia.org, you can learn more information about it. We would love for the NHPI community and others to be involved in how do we ensure that the challenges and the obstacles that we're all experiencing from coronavirus can be used in this moment to strengthen our community and really move us forward. That's work that we're all committed to, and I'm looking forward to doing that work with all of you. Thanks. And one last thing, my apologies. I have a 12:30, another virtual call I need to do. But if any of you have questions or need to reach out, please don't hesitate to reach out to my office. Thanks so much.
Well, and then another announcement that we would like to make for everybody. So we did cap out at 300 folks that can join us on a Zoom, and there are like literally 100 plus people that weren't able to make it. So just encouraging folks to tell their friends and family members who did want to join that they can get information from the Pacific Islanders Center of Excellence for Primary Care. And that information is listed in the chat, and also our members can send that out as well. So next up, and I'm not sure if our next Assembly member, Rob Bonta, is here with us. Rob Bonta, are you here with us? Okay.
I'm here, yeah. Hi, Joseph. Rob Bonta.
Awesome. Let me do a quick intro for you. So Assembly member Rob Bonta was elected to the California State Assembly's 18th District in 2012, where he represents the cities of Oakland, Alameda, and San Leandro. He became the first Filipino-American state legislator in California's then 160-plus year history. Rob's passion for opportunity and equality was instilled in him in a very young age by his parents, who taught him to understand injustice and the importance of joining the struggle to empower vulnerable and disadvantaged communities. His father was involved in the civil rights movement and stood with Dr. Martin Luther King Jr. in a Deep South marching for equality and justice in Selma. His mother continues to be a longtime leader in the Filipino social justice movement. Welcome, Assemblymember Rob.
Thank you, Joseph, for mediating this conversation and for your leadership. Thank you to the Pacific Islanders COVID-19 response team for pulling us together, for pulling this coalition together to have this very important discussion. Again, Rob Bonta here in the California State Assembly, honored to be the first Filipino-American state legislator. And I just want to first off say I hope everybody is healthy and safe and well, all things considered. I know it's a very difficult time, and I do want to iterate that I don't think it can be said enough that we all need each other more than ever, that our inescapable network of mutuality, as Dr. King said, is so important to remember, and how our actions and our decisions affect all of us at this time. You know, one of the key things that that COVID-19, the pandemic has revealed is underlying pre-existing inequities, and it has in fact exacerbated them. as well. And so it's so important for leaders like all of us who believe in equity and justice and opportunity and inclusion, that we always look at our crises and our challenges through that equity lens. When you're in a crisis, the most vulnerable community members are the first to suffer and the worst to suffer, and are also deserving of the greatest and earliest support in order to address those inequities. And so, a couple of key issues. First of all, it's very, very important to raise our voices into the conversation about health disparities based on race and ethnicity, the impacts on the NHPI community. And I know that that's obviously a top priority. That's why we're having this discussion. But a lot of the discussion up to now has focused, as by some of my colleagues and my panelists on this call have also discussed, a lot of the focus has been on the African American community, the Latino community. So raising our voices as API leaders will be incredibly helpful in getting the action that we need. When we talk about data, it's so important to make sure that the evidence and the data, the facts that we have are disaggregated. And I know that you all know how important that is. I was proud to author a bill called the AHEAD Act in California that sought disaggregated data for public health and in education. It was no small battle to seek disaggregated data. It became highly politicized, but it was the right thing to do, and we were successful, and we made some huge inroads. Disaggregated data, in my view, is good data. It's reliable data. It's accurate data. And with disaggregated data, you can reveal what was previously concealed. You can render visible what was previously invisible, and you see things that you otherwise wouldn't have seen. And it's important for all of our communities and all of their beauty and diversity to be seen, for us to know their experience and outcomes, and to take action to bend the curve or change what those outcomes are. So disaggregated data is absolutely critical. I'm going to push with my API caucus colleagues, my chair, who you just heard from, Assemblymember David Chu. I was honored to be the prior chair of the caucus, and to work in the Assembly Health Committee, which I chaired in the past and have been on since day one in the Assembly, to make sure that we have that data to drive our decision making and the actions that we take. And that those actions can include a lot of things that we've heard, making sure that our frontline essential workers in our communities have personal protective equipment, that there's access to testing, that there's contact tracing, but we also need to address those underlying fundamental issues of access to healthcare, of access to food security and nutritious food, of access to housing. All those and other indicators dictate those pre-existing underlying health conditions. So there's a lot of work to do, but I really appreciate the lifting of our collective voice to raise this issue, to draw attention to it. We will also be committed to seeking disaggregated data to drive those actions that are necessary to provide more equity and more fairness and more just treatment for our NHPI community. So appreciate the opportunity to be here with you, and thank you all for your advocacy. Proud to be a partner.
Thank you, Assemblymember Rapont. Please stick around because we have some questions for you at the end there. Now for our community warriors. First up, I'd like to introduce Alisi Tulua, who is a program manager for the Orange County Asian and Pacific Islander Community Alliance, overseeing AAPCHO's health, youth education policy, and civic engagement programs. She holds a bachelor's in biochemistry and cell biology and a master's in biology from University of California. She will be going over our California stats. Thank you. Welcome, Alisi.
Thank you. Thank you to everybody that has spoken before me. I truly am honored to be speaking on behalf of our California data and work. And so shout out to all of our California representatives who are showing out today. First of all, I want to pay my respects to all of the elders that are on this call, to all of you community leaders. Thank you for continuing to lead our communities. And we know that we can do this as long as we do it together. Before I get into the data, which you are seeing here, I just want to give credit to everybody that's doing census work. We would not be able to show any of these numbers without all of you who are continuing to push for our communities to be counted. And so I'm giving a shout out to all of you that are continuing to outreach to our community to get counted. These numbers would not be possible without the tireless work of those of you that are making sure that we are counted in the census. I also want to say thank you to all of our advocates who have continued to push for data disaggregation. I'm really excited that that has been a point of conversation this morning. And so to Congresswoman Judy Chu and folks like Warren Furutani, Mike Eng, of course, Assemblymember Rob Bonta, Dr. Richard Pan, and those of you that are continue to push for our voices at the state and federal level. I also just want to say thank you to all of our partners that are continuing to do health disparities work, highlighting Native Hawaiian and Pacific Islanders. I know that Dr. Neil Palafox is on the call. Thank you for continuing to raise the issues around health and health disparities for our community. Also folks like Dr. Sora Park Tenjasiri, Margie Kagawa Singer, and all of you that continue to lift our communities, especially around health issues. California holds the largest population of Native Hawaiian and Pacific Islanders outside of the state of Hawaii. And so it is only appropriate that we highlight this. And unfortunately, as Dr. Samoa said, we wish that it was in better circumstances. I'm sharing here the most updated data that we have with regards to the cases that exist in California. So as you can see here, there have been 412 positive cases in California, and relative to our very small population, we make up 0.3% of California's population. However, when you look at our percent cases, it is triple that number. And this shows up in terms of 287.5 case rates per 100,000 people, which is much higher than the state average. Next, please. I want to highlight LA County. We have been fortunate to be able to receive much of this data. LA County actually holds the largest population of Pacific Islanders in the state of California. As of April 22nd, we did not have our NHPI data recorded or reported by LA County. Fortunately, we have folks like Dr. Paul Simon, who is the Chief Science Officer at the Department of Public Health, who advocated for our data to be reported despite it not meeting a certain threshold. And so as you can see here, fortunately, we're able to see how much higher the burden is on our community. We have 192 cases in LA County, so almost half of the cases in California that are carried in LA County. And when you look at the case rate per 100,000 people, our case rate is 981.33, compared to an average case rate for LA County of 253. And when you look in comparison to other communities, this is multiple factors higher. There is a Southern California regional response team that has advocated for our data to be reported and are also working to advocate for Long Beach to be reported. Some of the other work that we're doing in that group, led by Calvin Young, is we are trying to get the word out on testing for our community. Because sometimes testing criteria are different by city. We're trying to make sure that our community gets the information. We're working really closely with the Department of Public Health in LA County to translate materials. In fact, we sent out a letter to all of the church leaders in LA County about COVID-19 and the possibility of churches reopening up in about a month and a half or so, and encouraging them to think twice about how they engage the community. These are just some of the examples of the work that we're doing in LA County. And what we're hoping is that, at least for California, that we can see the same level of work across all of our counties. Next slide, please. We're fortunate to see that our data is disaggregated in LA County. Unfortunately, after looking at our top 10 counties in California, 4 out of the 10 is disaggregating NHPI data. The remainder of our counties either are reporting data.
If you put more grass seeds on the ground.
They're either reporting data as API or there's no Pacific Islander data at all. And so when you look at Northern California, where we have a large population, our three largest counties, Santa Clara, San Mateo, and Alameda, are not reporting our data disaggregated. And so it's hard for us to look at how we can support our community without this data disaggregation. And so as much as it has been highlighted, we want to continue to work with our state officials and especially at the federal level to continue to enforce OMB 15 and also advocate for our individual counties and hopefully our cities to disaggregate our data. It helps us have a more keen understanding of how to support our community and how to be of resource. And so with that, I want to hand it back to Joseph. And I am putting out a call to any of you that are in California that are interested in supporting us to reach out to us. Our contact information is in the press release. We would be more than happy to expand the team, more hands to make the work lighter. Thank you.
Thank you, Alici Tulua. Next up, another community champion. I want to introduce everybody to Oreta Maputupola. MSW is proudly from the North Shore of Oahu, Hawaii, and currently resides in Utah. Among her many professional hats, she is the manager of the University of Utah Community Health Program and a co-founder of the Utah County Pacific Islander Health Coalition. She brings years of experience working in public health, social work, and health policy for underserved populations. Oreta?
Can you hear me?
Yes, we can hear you.
Okay. Telephone, thank you for this opportunity. I'm just going to do a brief share of Utah's data. In Utah, our Pacific Island community is the second highest ethnic group, following the Hispanic and Latinos in both the state of Utah as a whole and Salt Lake County, where most of our Pacific Islanders reside. Some of the alarming data for us is that out of the positive tests that have been taken in Utah, 40,672, 2,438 are Pacific Islanders, second to the Hispanics. In our state, we are 1.5% of the population, but 2.3% of the cases are Pacific Islanders. Hospitalized, we have 390, 14 are PI, and the death rate is 45 and PI 29. So we're second to the Native Americans. One of the issues we've identified has been mentioned already, has been access to testing. And so, especially in the areas where most of our Pacific Islanders reside, in West Valley City and Glendale. But we have put in new mobile testing sites to accommodate that. And so now our community is able to go in, drive through and get testing for free. We also have, our state has organized a minority task force to address this. So we will continue to advocate for our communities by providing access and other resources. And one of the other ways that we've tried to address what's going on is the difficulty for our community to sort through all the information that's being provided out there about what to do, what is safe, who do I go to, who can we trust. And so our Pacific Island Coalition has been working on a central site for all of these resources to be provided so that they understand what the latest updates are for the state and where they can get resources and get testing for free. If they need any other information, we have a committee that is submitting all of this information, and we're going to provide it through this central site. Also, so something that we would like to ask our community members is to continue to adhere to the safety guidelines provided by the State Department of Health. And also, if they need to get testing, to please go to the testing centers that are provided in their cities. We understand that there's a lot of stigma going around about being tested or being found positive for testing, and we want to make sure that our community understands that this is not the time for us to shame people or to be ashamed of getting tested. And so we want to make sure that we are providing information about why it is important and what safety guidelines they can practice in order to keep their family safe. And then we also just want to continue to share with our community that there are programs for free masks for people that don't have access to them to keep their families safe. But as they're going out, to continue to practice those safety guidelines and think about our most vulnerable community members, our matua and our children, so that we can keep them safe from this disease, pandemic. We want to also thank everyone for the work that they are doing to keep our community safe. We are in the same boat with all of you and understand that we can only address these things together, but making this information and these kinds of platforms available so our community can learn about how to access information has been very important for us. And so that's what we're trying to do through our advocacy, through the Health Coalition, and also through this multicultural task force that the governor put together. Thank you.
Thank you, Oretta. And last but not least, I introduce my sibling, Manumalo Ala Ilima, who is the current chair of Utopia Portland, a queer and trans Pacific Islander-led organization. Manumalo is also the NPO voting member of the Pacific Islander Coalition, a culturally specific advisory board for Multnomah County Health Department, and also a member of the Oregon Pacific Islander COVID-19 Emergency Response Team. So I'll hand it over to Manumalo.
Untitled Lava Molabanoa, Joseph, Talofalava, Malo Lele, greetings from the state of Oregon. There is currently around 4.2 million in the state of Oregon, and of that number, there is an estimated 26,000 Native Hawaiian and Pacific Islander population. In terms of COVID-19, there are 62,054 people that have been tested. Of that number, 2,610 have been confirmed positive. Next slide, please. What we've learned from this data also is that for the Native Hawaiian and Pacific Islander demographic, that we have 26 confirmed positive cases, which make up 1.1% of the total cases, and that we have 8 hospitalized, and we experienced our first death in our community last week. The most startling of this information is that Pacific Islanders have the highest rate of infection at 15.4 per 10,000 out of all races in the state of Oregon. Next slide, please. We were able to have a little victory last Friday when we were able to advocate for Pacific Islander to be included as a higher risk group for COVID-19 priority testing in items 2G and 2H, according to the testing guidelines for reopening in Oregon. When it first was published on April 20th, we weren't part of that group. So from that time until this past Friday, a group of Pacific Islander community members and leaders have convened, and we have been forming our Oregon Pacific Islander COVID-19 Emergency Response Team. Next slide. We just have some call to action items. We need more volunteers throughout the state of Oregon to help with our Oregon Pacific Islander COVID-19 Emergency Response Team, partnering with our local health and government agencies at the city, county, state levels in collaborative work for our community. We've already been doing incredible work with Multnomah County, which is the largest county in Oregon, as well as having discussions with Governor Kate Brown's office. Another thing that we really would like some focus on is that for our public and private healthcare systems and lab processing facilities should use real D intake for COVID-19 monitoring to capture accurate race and ethnicity data. Without that, we really don't know all those people who are marked as other, what race and ethnicity do they really have? And then also, we need volunteer inquiries, or you have questions, please email us at pacificislandercoalition@gmail.com. Again, it is pacificislandercoalition@gmail.com. And lastly, if you are not part of the essential workforce, please stay at home. If you must go out, please observe public health advisory for wearing masks, physical distancing, and hand washing and sanitizing. Thank you. And back to you, Joe.
Thank you, Manumalo. So we're now at 12:52 with not a lot of time for questions. So we apologize. This is our first press conference, so we're still figuring out, timing and all of that. But just a quick question to our Congresswoman who's still with us, and also Assembly Member Rob Bonta. So the NHPI community are often locked out of places and tables where they can make decisions towards their community's health and contribute to policy work. What are maybe some commitments from both of you to ensure that we have equitable representation and that our voice is at the table, as opposed to having us, typically take on a tokenization role and not at the table?
Well, thank you for that question. First of all, I'm really impressed with the participation on this particular town hall and press conference. In fact, there were so many people that wanted to tune in that you couldn't accommodate everybody. So it shows that certainly NHPIs know that there is a crisis going on here with the community and COVID-19. And in fact, let me say that the story of what's going on with NHPIs has certainly not been told. I am starting to grasp the gravity of it myself, and I am talking about it wherever I can with my fellow colleagues in Congress. And in fact, I talked about it with Speaker Pelosi just last week, because clearly this is a community of color that is being very drastically affected by COVID-19. And it is very clear that there has to be resources allocated to NHPIs, whether it's in the increased testing or in the increased treatment for NHPIs who actually are infected with COVID-19. And also, of course, there's issues that are specific for COFA migrants. One thing I do want to tell you is that we did have a provision in this last bill that we, the Democrats, pushed for, which was for Medicaid coverage for our Compact for Freely Associated States migrants. And we had it in there, but the Republicans took it out. So we have been constantly pushing for this as an issue specific to Pacific Islanders. But I want to say also that that we need to make sure that everybody does get tested. And I do want to reiterate, since I've now found out that in California, half of the Pacific Islanders who are infected are in LA County. Yes, in LA County, anyone with symptoms can be tested. You just have to go online and make an appointment. But of course, you have to say what your symptom is, because you do have to have that. And in fact, if you're an essential worker, that is a criteria for being pushed to the front. So remember that, and be sure to get out to one of the over 30, I think there's now 35 testing sites in LA County. And of course, if you actually live in the city of LA, then you can be tested at one of the 8 sites, regardless of whether you have a symptom or not. So
thank you, Congresswoman.
Yeah, thank you.
There you go.
Hi, yeah. Hi, thanks for your question, Joseph. I'll just say this: you're always at the table with the API caucus. We support our brothers and sisters, and uplift each other's issues. We're on an ongoing struggle to include more and more of our diverse API voices in the state legislature. I happen to be the first Filipino American after 162 years of experience in the state of California. And we've had the first Indian American recently, AAPCHO. So we're still breaking through barriers, still growing our inclusion. But our job and our role is to think of all of our brothers and sisters, think of the entire diversity of our API community, and bring those issues forward and fight for them together. We're a coalition, we're a team, we're a family. So we've done this before. This isn't something that's forward-looking. This is what we did with disaggregated data, with the AHEAD Act, the bill we all fought for together side by side in California, and it's what we'll continue to do. And one of the first things I noticed in the presentation on California was that my county, Alameda County, according to the report, is not collecting NHPI data. That's a problem for me. And so we're already on the phone talking to them about why that's not happening and to change that. So that's what we do. That's what we should be doing. We should be doing it at the state level and as well, and at every level of government, wherever data is being collected. We need to make sure that every community's experience is known and revealed and understood. So my commitment is that we fight as a coalition and as a family going forward, and your voice is our voice.
Thank you, Assemblymember Ponta. So I'm going to turn it over to Samoa, and Samoa, as you're closing us out, there's also a question about what the biggest contributing factors of PI deaths, and also what does the recovery look like as far as how are folks being tracked?
So as I mentioned earlier, the largest contributing factors seem to be the high percentage of essential workers that make up the community. Other contributing factors are, historical lack of access to economic resources and healthcare, along with a high prevalence of chronic diseases. And so all of this entire mix increases our risk of catching COVID-19, but also increasing the risk of death from COVID-19. So those are probably the most identified contributing factors. And then I didn't get the second part of that question.
There was a question from Lydia Faitalia around how is recovery being tracked, like recovery rates being tracked across the public health spectrum?
Not well at all. Tracking period is problematic. I should make note that when this group got together and they developed the strategy, this was not a haphazard approach. We combed through every publication that spoke to the initiatives that were done by these countries that are beating COVID-19, such as Taiwan, such as South Korea, such as Iceland, and now even New Zealand. And we looked at those initiatives and were able to break down what they did into large categories. And we looked at which ones were feasible for us to do here in the US. So for that reason, we were able to develop a strategy that's based on testing and tracking, safe shelter, resources, and communication, because you're not going to beat this just by testing alone. You're not going to beat this by just isolating. You have to do this comprehensively, And so the national strategy has been pushed down to the regional teams, and I am so unbelievably awestruck by how the regional teams have taken these strategies and have pushed them light years forward in just the relatively short time that they've been in existence. In 2 weeks, they've been able to get data that wasn't presented for and able to present this really devastating phenomenon that's going on. And that's been solely, and that's a lot of it has been because we also have partners and allies that have been helping us. But the driving force has been the community advocating for themselves, And so one of the things that we're noticing is that there is a deficiency in how public health is approaching COVID-19 when we look at the strategies that are working. it is incumbent upon us as advocates for our people to make up those deficiencies on the federal, state, county, local levels by advocating for those things in our communities. So it means we're going to have to use our community wisdom. We're going to have to be able to access things that public health entities cannot access, such as our church rosters, such as our social groups, such as our media group on Facebook and Instagram. All of this is going to require community leadership if we're going to identify, track, and isolate our people safely. So before we leave, I do just want to make note of a couple of things. You can have access to the strategy at our convening organization's website, the Pacific Islander Center of Excellence for Primary Care. If you want to sign up, if you can do a TikTok video, if you have access to the community, if you have some type of capacity in data analysis, in marketing, in anything you can imagine, or if you are just a community member that wants to get involved, please join us. There are links on this announcement and the promo that will show you how you can get involved. And so I leave you with this, that it is a dark time for us. It looks almost overwhelming, but as Pacific peoples, struggle is not new to us. And we've overcome obstacles that we have been forced to face in the past. And we've done that. We've done that by coming together and showing up for each other. And so when you spread the word about staying safe on social media, when you wash your hands, when you social distance, when you worship virtually instead of going to church physically, when you bring food to those who are hungry, when you pray for each other, we are showing up for each other. Because when this is all over and we come together again and we eat the foods that I tell you not to eat together, and we share jokes with each other, and we begin to start to look like what we used to look like, you know, let's be able to tell our children's children that we did not stand idly by and watch our people die, that we stood united. Because I don't see us getting through this without each other. So thanks, everybody. And please, the recording will be made available. So if you want to rebroadcast it, you're welcome to. And then if you have any questions, there's contact information in the promo for you to join us. Thank you so much.
Thank you.
Love you all. Take care.
Love you.